Hello, everyone, and welcome to our lecture on rapid response teams. Before we start, let me ask you a question. Have you ever had a day where everything seems to be going smoothly, and then suddenly, out of nowhere, a crisis occurs? Well, that's precisely why we're talking about rapid response teams today. These teams are like superheroes, swooping in to save the day when a patient's condition takes a sudden turn for the worse. In this lecture, we'll discuss the vital role that rapid response teams play in healthcare settings and how you, as future nurses, can contribute to these life saving interventions. So, buckle up and get ready to learn about these healthcare superheroes because knowing how to work with rapid response teams can make all the difference in providing the best possible care for your patients in critical situations. Let's look at the objectives for this presentation. We will understand the role and importance of rapid response teams in healthcare settings and their contribution to life saving interventions during patient crises. Identify the typical members of a rapid response team and their respective roles in providing comprehensive, collaborative care during a crisis situation. Recognize the criteria for activating a rapid response team, including clinical manifestations that indicate a patient's rapid decline and warrant timely intervention. Master the use of the SBAR communication technique, situation, background, assessment, and recommendation to ensure accurate and efficient information sharing during a crisis situation. And emphasize the significance of debriefing, follow up, and education after a rapid response team call to improve skills, address system failures, and enhance patient outcomes. Now that we've established the importance of rapid response teams, let's discuss who makes up these teams and their respective roles. A rapid response team typically consists of critical care experts who come together to assess, stabilize, and manage a patient's condition during a crisis situation. Think of it as a healthcare dream team, with each member playing a crucial role in the patient's care. So, who are the superheroes on this dream team? A rapid response team usually includes an ICU nurse. This highly experienced nurse brings our critical care expertise to rapidly assess the patient's condition and initiate appropriate interventions. A respiratory therapist. The respiratory therapist is the go to person for managing airway and ventilation issues, ensuring the patient maintains adequate oxygenation. A critical care provider. This can be an intensivist, a nurse practitioner, or a physician assistant who specializes in critical care. They are responsible for coordinating the team's efforts and making crucial decisions about the patient's care plan. A hospitalist. A hospitalist is a physician who provides medical care to hospitalized patients. They bring their knowledge of the patient's medical history, medications, and overall care plan to the team. And in some cases, additional team members such as pharmacists or other specialists may be included, depending on the patient's needs. Each team member contributes their unique expertise to ensure a comprehensive and collaborative approach to managing the patient's crisis. By working together, the team can quickly address the patient's needs, stabilize their condition, and ultimately save lives. Just like superheroes swoop in to save the day, rapid response teams are there to provide early recognition and response when a patient exhibits indications of rapid decline. Their timely intervention can help prevent potentially catastrophic events, such as respiratory or cardiac arrest or stroke. In essence, these teams are the healthcare equivalent of the Avengers, assembled to face a crisis and protect patients from harm. The primary purpose of rapid response teams is to swiftly identify and manage patients at risk for clinical deterioration. By doing so, they help to reduce the incidence of in hospital emergencies such as cardiac arrests and unplanned ICU admissions. This early intervention can not only improve patient outcomes, but also reduce the overall burden on healthcare resources. To ensure the effectiveness of the rapid response team, healthcare settings must have established policies and procedures for activating and utilizing the team. These guidelines outline the specific criteria for calling the team, the roles and responsibilities of team members, and the communication protocols to be followed during a crisis situation. So remember, rapid response teams play a vital role in the early recognition and response to patient decline, preventing potentially life threatening events such as respiratory or cardiac arrest or stroke. Like our beloved superheroes, they are a formidable force in the fight to protect patients and save lives. Just like superheroes need training to perfect their skills and learn when to leap into action, healthcare personnel must also be well versed in recognizing the criteria for calling assistance when a patient's condition changes toward a crisis situation. Proper training ensures that our healthcare heroes can identify the need for a rapid response team, paving the way for timely intervention and improved patient outcomes. Training for healthcare personnel should focus on recognizing the signs and symptoms that warrant activation of the rapid response team. By mastering this knowledge, healthcare professionals will be better equipped to make those crucial decisions when time is of the essence. Here are a list of clinical manifestations that might indicate the need to call in the rapid response team, along with the rationale for each. Sudden changes in vital signs. A rapid deterioration in blood pressure, heart rate, or oxygen saturation levels may suggest an impending crisis requiring immediate intervention. Acute respiratory distress. Rapid breathing, wheezing, or cyanosis may indicate a life threatening respiratory issue that requires the expertise of a rapid response team. Severe chest pain. Chest pain may signal a potential heart attack, necessitating rapid assessment and treatment. Altered mental status. Sudden confusion, disorientation, or unresponsiveness can be signs of various life threatening conditions, such as stroke or severe infection. Seizures. New onset seizures or recurrent seizures in a patient with a history of epilepsy may necessitate urgent evaluation and management by the rapid response team. So, our superhero healthcare personnel must be well trained in recognizing the signs and symptoms that warrant activation of the rapid response team. Equipped with this knowledge, they'll be ready to summon their fellow heroes when the need arises, working together to save the day and ensure the best possible outcomes for their patients. Now let's discuss the importance of effective communication during an emergency. Just as superheroes have their own unique ways of communicating with their team members, healthcare professionals also need a structured method to relay critical information. Enter the SBAR communication technique: situation, background, assessment, and recommendation. Using the SBAR technique when contacting the rapid response team and documenting the event ensures that all relevant information is shared accurately and efficiently. This allows the team to respond appropriately, providing the best possible care during a crisis situation. So, first, situation. Clearly describe the current situation or concern. For example, the patient is experiencing severe chest pain and shortness of breath. Background. Provide relevant background information, such as medical history, medications, and any recent procedures or interventions. This could include information like the patient had a coronary artery bypass graft surgery 1 week ago. Assessment. Summarize your assessment of the patient's condition, including vital signs, physical examination findings, and any other pertinent data. For instance, the patient's blood pressure is 90/60, their heart rate is 130, and oxygen saturation is 88% on room air. Recommendation. Offer your recommendation or request for the rapid response team's assistance. This might sound like, I am requesting the rapid response team's assistance for further evaluation and management of this patient's chest pain and respiratory distress. Remember, during an emergency, time is of the essence. Using the SBAR communication technique ensures that the rapid response team has all the necessary information to leap into action and save the day, just like the superheroes they are. In the world of superheroes, after every mission, our heroes come together to discuss what went well, what didn't, and how they can improve for future challenges. Similarly, after a rapid response team call, it's essential to implement follow up, education, and debriefing for all participants involved. This process allows the team to learn from each experience, ensuring that they are continually improving their skills and working together to save lives. Debriefing after a rapid response team call helps to identify any system failures that may have occurred during the event. These can include not recognizing a crisis, inadequate communication, or a failure in the plan of care. By addressing these issues head on, Healthcare settings can work towards improving their response to critical situations and enhancing patient outcomes. For example, during a debriefing session, the team might discuss how they could have better recognized the signs of a deteriorating patient, or how communication could have been clearer or more effective. They may also identify areas in the plan of care that could be updated to better address the patient's needs. By addressing these issues in a collaborative, supportive environment, the rapid response team can learn from each call, honing their skills and ensuring they're ready to be the superheroes their patients need. So remember, just like our favorite superheroes, the rapid response team is a vital part of healthcare settings, providing life saving interventions during times of crisis. By continually improving their skills through debriefing and addressing system failures, they can work together to provide the best possible care. As we wrap up this lecture, let's remember that our healthcare superheroes, the rapid response teams, play a vital role in providing early intervention and preventing adverse outcomes for patients experiencing rapid decline. Just like in the comic books or movies, teamwork and effective communication are crucial to their success. It's essential for you, as future healthcare professionals, to understand the purpose, function, and activation criteria for rapid response teams. Don't forget the importance of the SBAR communication technique, which ensures that accurate and efficient information is shared during a crisis. Finally, always be prepared to participate in debriefing sessions to identify system failures, learn from each experience, and improve the quality of patient care. In the dynamic and fast paced world of healthcare, it's crucial to stay up to date on best practices for utilizing rapid response teams. By mastering your knowledge and skills in this area, you'll be prepared to handle critical situations and provide the best possible care. So let's suit up and get ready to be the healthcare superheroes our patients need. With the knowledge you've gained today, we can each be confident in our ability to manage critical situations and contribute effectively to the work of rapid response teams. Thank you for your attention, and remember, with great power comes great responsibility.